Welcome back to Deep Dive Med.
Ready for another deep dive?
Absolutely. Today, we're tackling dosage calculations.
Oh, interesting.
We're using this review guide. It's mainly for respiratory therapists,
Okay.
but anyone can benefit from understanding this stuff. It's about how medication doses are figured out, how they're given to patients.
Makes sense.
So, whether you're a patient yourself or taking care of someone, this deep dive can make you a more informed advocate.
I like it.
What I found really interesting is how this guide starts with, really basic math.
Uh-huh.
Fractions, decimals, percentages, converting between metric and imperial units.
Right.
All super important for getting those dosage calculations exactly right.
It's like the foundation. You can't build a house without a good foundation.
Exactly. And you know what else the guide stresses? Medication errors. They're a big problem.
Yeah.
And knowing how to do these calculations correctly can literally be a matter of life or death.
Really drives home the point that accuracy is like everything in healthcare.
No kidding. Now let's talk conversions.
Yeah, conversions.
The guide's big on understanding both metric and imperial systems.
I mean, here in the U.S., we use pounds and ounces every day.
But medicine, it's all grams and milliliters.
Totally different languages.
And being able to switch back and forth between them, that's essential for safety.
Absolutely. Like the guide has this example of converting a patient's weight from pounds to kilograms.
Right, because that determines the correct dose.
Imagine the consequences if someone got a dose based on pounds when it should have been kilograms.
Oh, that's a scary thought. Really highlights the need for clear communication and precise calculations.
For sure.
Okay, let's get into the nitty-gritty. The dosage calculation formula.
The heart of it all.
So the guide gives us this core formula. It's desired dose divided by dose on hand equals amount to administer.
Interesting.
Can you break that down for us?
Yeah, so think of it like baking.
Okay.
You want to make a cake. The desired dose is like how much cake you want, the final product. The dose on hand is like all your ingredients, flour, sugar, whatever, the amounts you have available.
Right.
And the amount to administer, that's how much of each ingredient you got to use to get that perfect cake.
Okay, I see where you're going with this.
So when it comes to medication,
Yeah.
the desired dose is what the doctor prescribes.
Okay.
The dose on hand is the concentration of the medicine you have.
And when you divide those two, you get...
The amount to administer, which tells you exactly how much medicine to give.
Makes perfect sense.
The guide uses this example with albuterol, a common respiratory med. Let's say the doctor orders 10 milligrams of albuterol,
Okay.
and what you have on hand has a concentration of 2.5 milligrams per 0.5 milliliter.
Oh, wow.
Using that formula, you can calculate that you need to administer 2 milliliters.
Gotcha. So now, the guide also mentions something called unit dose ampules.
Oh, yeah.
What exactly are those?
They're like pre-packaged single doses of medication. Ensures accuracy, and less waste because you're not measuring out tiny amounts from a big bottle.
Makes sense.
Each one has just the right dose, like those single-serving coffee pods, convenient and precise.
So if you needed, say, 2 milliliters of albuterol and each ampule had 0.5 milliliters.
You'd need 4 of them to get the correct dose.
Exactly. Now, let's move beyond single doses, talk about how meds are often mixed in solutions.
Right, solutions.
And they have a specific percentage strength.
Uh-huh.
Okay, what's the deal with percent solutions?
Think of it like mixing up lemonade.
Lemonade.
Yeah, you've got your lemon juice concentrate and then you've got water.
Right.
The percentage strength of your lemonade depends on the ratio of those two.
So a higher percentage strength means a more concentrated solution.
Bingo.
And with medicine, this percentage, it refers to grams of medication per 100 milliliters of solution.
Yep, like albuterol often comes as a 0.5% solution.
Right.
There are 0.5 grams of albuterol for every 100 milliliters of solution.
Interesting. So how do we use this info to figure out the volume of solution we need based on the dose in milligrams?
That's where things get a bit trickier. But stay with me. Let's say we need to give 2 milligrams of albuterol.
From that 0.5% solution.
Right, so we know it has 0.5 grams of albuterol.
Per 100 milliliters.
Exactly. But our desired dose is in milligrams.
So got to convert grams to milligrams, right?
You got it. There are 1,000 milligrams in 1 gram. So 0.5 grams per 100 milliliters becomes...
500 milligrams per 100 milliliters.
Now we're talking milligrams and milliliters.
Okay, now what?
Back to our trusty formula.
Desired dose divided by dose on hand equals amount to administer.
You got it. In this case, our desired dose is
2 milligrams.
And our dose on hand is?
500 milligrams per 100 milliliters.
Oh, right. Let's think of the dose on hand as a ratio.
500 milligrams over 100 milliliters.
Okay, now plug everything in.
2 milligrams divided by 500 milligrams over 100 milliliters equals the amount to administer. To divide by a fraction, we flip it and multiply, right?
That's it. So 2 milligrams times 100 milliliters over 500 milligrams.
The milligrams cancel out, leaving us with 2 times 100 milliliters divided by 500.
Which equals?
0.4 milliliters.
To deliver 2 milligrams of albuterol from that 0.5% solution, we need to administer 0.4 milliliters.
Got it. And what's cool is this guide, it doesn't stop there. It shows us how to work backward. Figure out the percentage strength if we know the active ingredient amount and the total volume.
Like reverse engineering it.
Exactly. Let's say we have a solution with 2 milligrams of active ingredient in 10 milliliters.
Okay.
What's the percentage strength?
Remember, percentage strength is grams per 100 milliliters.
For every 100 milliliters, there are this many grams of the active ingredient.
Right. So first, we figure out how many grams of active ingredient are in 100 milliliters.
We know we have 2 milligrams in 10 milliliters. Can we just scale that up?
Sure. Set up a proportion. 2 milligrams is to 10 milliliters as X milligrams is to 100 milliliters.
Like saying, if I have 2 apples for every 10 oranges, how many apples would I have for 100 oranges?
Exactly. To find X, we cross multiply.
2 milligrams times 100 milliliters equals 10 milliliters times X.
Simplify that.
200 equals 10X. Divide both sides by 10, so X equals 20 milligrams.
There you go. 20 milligrams of active ingredient in 100 milliliters.
But percentage strength uses grams, not milligrams.
Right. Got to convert. 1 gram has 1,000 milligrams.
So 20 milligrams divided by 1,000 milligrams per gram gives us 0.02 grams.
0.02 grams of active ingredient in 100 milliliters.
So the percentage strength is 0.02%.
We did it.
That felt good. Amazing what you can figure out with a bit of math and some conversions.
This guide is fantastic, packed with info. What else caught your eye?
I keep seeing drops as a measurement. Seems imprecise compared to milliliters or milligrams.
Drops. Yeah, they're interesting, used for liquid meds, especially for kids or tiny doses.
But the size of a drop can vary.
That's right. Depends on the medication and the dropper.
How do they make sure it's accurate then?
Standardized droppers. They deliver a consistent drop size.
So like 10 drops would equal a specific volume in milliliters.
Usually around 0.05 milliliters per drop. So yeah, 10 drops would be about 5 milliliters.
Makes sense.
Okay.
But always double check the label and dropper instructions just in case.
Absolutely. Always best to be safe.
It's a good reminder that even though we're learning all this, we still need to listen to healthcare professionals.
Totally agree. This guide is about giving us knowledge, not replacing doctors and pharmacists.
Speaking of knowledge, the guide also talks about body surface area, or BSA.
BSA. It's the total surface area of a person's body.
Measured in square meters.
Yep. Used to calculate dosages, especially for chemo drugs and some kids' meds.
Why not just use weight or height?
BSA considers both. Gives a better picture of body size. Important for meds that affect the whole body or have a narrow range for safe dosage.
How do you even calculate that?
There are formulas and charts. The guide uses the Mosteller formula. Square root of height in centimeters times weight in kilograms, divided by 3,600.
Sounds complicated.
The guide explains it well with examples, and there are online calculators too.
So if I know my height and weight, I can find my own BSA.
You bet. It's helpful to know, especially if your doctor prescribes something based on BSA.
Never realized how much math goes into medication. Like a whole hidden world.
That's what's so cool about this guide. It pulls back the curtain, shows us all the calculations and factors they consider.
It's empowering to know how it all works.
Absolutely. And there's still more to discover. In our final part, we'll cover even more tips for mastering these calculations.
We've learned about conversions, percentage strengths, even body surface area.
It's been quite a journey.
But our guides still have more to offer. What else jumped out at you?
You know, they really stress double-checking calculations, especially with high-risk meds or patients who are sensitive to dosage changes.
Like, measure twice, cut once, but with much higher stakes.
Exactly. The guide suggests different ways to double-check. Have another healthcare professional look it over. Use online calculators.
Speaking of online resources, they mention staying up to date on medication info.
Super important. Drug formularies and guidelines are always changing.
So even though we're learning these calculations, gotta remember healthcare is dynamic.
Absolutely. And you know, another key point is individualizing dosage, taking patient-specific factors into account.
Right, because everyone reacts to meds differently.
Exactly. Age, weight, kidney function, liver function, even genetics, they all play a role in how someone metabolizes a medication.
So it's not just a one-size-fits-all approach. It's about tailoring the dose to each patient,
For safety and effectiveness. And that's where healthcare professionals really come in.
with their knowledge and experience to adjust dosages based on the patient's unique needs.
Right on.
This deep dive has been eye-opening. I never realized how much goes into dosage calculations.
It's a whole world behind the scenes, right?
It is, and it's empowering to understand it better.
I agree. The key takeaway for our listeners is, even though understanding these calculations is helpful, medication management is a team effort.
Between patients and healthcare professionals,
We should always ask questions, clarify instructions, advocate for ourselves.
combining knowledge and open communication, that's how we navigate medication safely.
Couldn't have said it better myself.
Well, this deep dive has been incredibly informative. I hope our listeners feel empowered to learn more about their meds and talk to their healthcare providers. Knowledge is power, especially when it comes to your health. Make sure to like and subscribe to the channel so you don't miss our next episode. For more exclusive content, check out our Patreon below for details. See you next time.
See you then.